Hi everybody, it's Dr. Osgood here with GrassRoots Functional Medicine. One of the most common questions we receive at our practice is what is functional medicine and what makes it different from the traditional medical model. So today I just wanted to give a quick overview of what functional medicine means to me in case you are interested in coming into the clinic and setting up an appointment. So functional medicine addresses the underlying causes of disease. We're not looking to cover up symptoms temporarily, we're looking to figure out why this is happening, and by addressing the why, that's what's going to lead to long-term health and optimal function. It's also a partnership. We work with our patients hand in hand. Our appointments are longer than your traditional appointments, and we are really trying to figure out, what's going on and what's driving this process of imbalance. Functional medicine is not a test. It's not a treatment and it's not a supplement. It's simply a way of thinking. There's two primary questions that drive the functional medicine approach. Number one, does this person have something that's triggering imbalance that they need to get rid of? And the second question is, does this person have some unmet need, or is there something missing that is required for optimal function? These are the primary triggers of inflammation that we want to investigate that often lead to imbalance in the body. Stress and hormone imbalances, toxins, antigens, such as food allergies or sensitivities, infestations and infections, nutritional deficiencies, sleep disturbances, sedentary behaviors, sociogenetic or relationship problems. These are some of those foundational elements that often will lead to dysfunction in someone's life. Here we're seeing what is needed for optimal function. We also want to focus in on these because they're very important. You can't have optimal health without the appropriate diet, and this is not a one-size-fits-all picture. It's going to vary for each individual person. You got to have the right minerals and vitamins, you got to have the right hormones, everybody needs the appropriate exposure to light, water, and air, you got to have movement and exercise, and you got to have that connection and love and community and that meaning of purpose. All of these are essential, and again, if we don't focus in on these and we just focus in on the disease process, you're not going to achieve that optimal state of wellness that we're all looking to see. The traditional approach to care involves a team of doctors, and sometimes this is absolutely necessary. When you have an acute problem, if you have a severe infection, if you have a car accident, or if you're having a heart attack, you need to be in the hospital. You cannot be conventional medicine when it comes to acute care. But for the chronic disease model, there's definitely some gaps that the functional medicine model is trying to fill. So most people come in and they've got a psychiatrist for their depression, they've got a gastroenterologist for their IBS, they've got a neurologist for their headaches, they've got an endocrinologist for their thyroid dysfunction, and the problem is none of these specialists are really talking to one another and really looking at how all these symptoms and how all of these systems are connected. The functional medicine approach is a little bit different. Again, we're focusing on the patterns and the connections, finding out what is triggering these clinical imbalances. And oftentimes by addressing the root cause, by addressing those foundational elements, those secondary symptoms just go away. And that's what we're really looking to achieve. We're looking to create balance on an individual basis because again, there's not a cookie cutter approach to any disease out there. You have to figure out what's going on specifically in each individual's life and in each individual's genetics and try to come to a conclusion that is beneficial for each person. This is the functional medicine tree. Typically with the traditional medical model, you start here in the middle, which is with signs and symptoms, and then you go to your specialist and try to get solutions based on what's going on and what symptoms are present. The functional medicine model starts down at the roots. Again, we're looking at those foundational elements, the sleep, the exercise, the nutrition, the stress, and the relationships, and we're working from there, again, up to achieve wellness from the bottom up. A good example of the functional medicine approach, comparing it to the traditional medical approaches with depression. Typically if people are sad or depressed, they go to their PCP and they may get prescribed a antidepressant because unfortunately in a 10-minute or 15-minute visit, that's all you have time to do, and I've been in that situation. But with the functional medicine model, because we do have time to investigate what's going on, we're trying to ask, why is that depression there? Is there a gut imbalance? Are there nutritional deficiencies? Are there environmental stressors that are messing with neurotransmitters, creating a sense of imbalance and those symptoms of depression? And that's what we want to resolve. So overall, that's really functional medicine in a nutshell. And if you have any questions, feel free to call the clinic, 888-644-7668. My name is Dr. Osgood, and if this sounds like a model that would work for you, I would love to partner with you on your journey to optimal wellness. Have a great day.